meeting. And I can see a couple of us have already joined and they kept time. I just hope that we are all safe and keeping healthy this time. So my name is Ruth Washuka, and I'm the One Young World Coordinating Ambassador in Kenya. And it's my pleasure to be hosting with you today. As we understand that every time the pandemic breaks, it's our responsibilities in the community to be able to respond. And we are a community of young people who I believe are very energetic. And so for this reason, we have the pleasure of the African Youth Union Envoy doing this consultation meeting with all of us to see what exactly we are doing and how the COVID-19 has affected our different aspects, because I understand that each of us gets to address a different goal. And so allow me to welcome Aya, and she can tell us more about this and in relations to what the African Center for Disease Control and Prevention is doing. There you go, Aya.
Thank you very much, Ruth, and thank you all One Young World ambassadors for joining. I think as we go, more will come in. So continue to share with your peers because this will be very informative as well for them on the state of COVID-19 Africa. I hope also joining Ruth in our hope that everyone is safe and coping with this difficult time. And welcome to the virtual AU Youth Consultation Series on COVID-19. This is consultation number 10. We've done so far convened about 140 youth leaders. And the purpose of these consultations is to form a collective youth response in Africa that can address the current crisis, disseminate timely information, support our government's efforts in prevention and response, and also a platform to get informed, share experiences as young people, knowing that you're not alone, that we're all in this together. In the African Union, the Centers of Disease Control and Prevention is leading the response on the pandemic, known as Africa CDC. It's a specialized technical institution of the African Union supporting member states to detect, prevent, control, and respond quickly and effectively to disease threats. So I'm very grateful for Dr. Guy Gerard for being able to join and on behalf of Africa CDC to provide a continental briefing on COVID-19 and engage with your questions and challenges. And I hope you will share also your experiences as you engage with Dr. Guy. And I hope we are now also taking some individual responsibility in our communities. We all know that we're faced with visible challenges, either the denial of the virus, that it exists and it's taken seriously, or the fear to the point of panic. And so there is a communication challenge there, which needs a lot of trust building and requires the collaboration of people to fight the pandemic. That's why, from the African Union perspective, we think that we have a role to play as young people and as ambassadors, and we are most placed to engage our peers, to mobilize them, to inform them, to influence behavior change in the community. So I look forward to hearing from you and your ideas, and how can we unite our efforts and play our part also in the solution and the service of our continent and our community.
Thank you so much, Aya. And so I'm looking forward to getting to engage with all of us to hear what we're doing. And of course, it's a privilege being here and having this opportunity. So just allow me to welcome Dr. Gerard on behalf of Africa CDC, so that he may take us through what CDC is doing in relation to this. And maybe after that, we'll be able to take in some questions. But for now, let's see what he's prepared. So welcome, Dr. Gerard.
Thank you, Ruth. Good afternoon. My name is Guy Gerard Kwame. I am one of the epidemiologists of Africa CDC. So I'm pleased to present the situation of coronavirus in Africa and what Africa CDC, what African Union, is doing to stop that outbreak. Here is the content of my presentation. It is long, but please be patient. So the first question is, what is COVID-19? COVID-19 is the name of the virus, the new virus. It's a coronavirus. We all know the SARS and the MERS, who happened 10 years ago, and the new version is named COVID-19. The first case was found in China in 2019, and they said it's from animals like bat or pangolin, but there is no proof, no real proof of that. But we suppose it's from animals. It causes respiratory illnesses, which can be fatal or mild or very small. What are the common symptoms? You know them: fever, cough, shortness of breath. And the duration, the appearance, it can appear 2 to 14 days after being in contact with an affected person. How it's transmitted? The most important is the contact between two people, one affected, the other not, the surface of table of some objects you have around you, and also by the respiratory droplets from an affected person. For the treatment and the prevention, there is no vaccine for this COVID-19. There is no treatment. Usually what they do is to treat the symptoms. You have fever, they can give you paracetamol in your treatment. That's an example. You have cough, we will treat cough, but there is no real treatment. You know that everybody is talking about chloroquine. Yes, chloroquine can be taken like treatment, but there is no scientific evidence until now, even if everybody is sure that you can use chloroquine in your treatment. How severe is it? Three situations. Most of the cases, 81% of the cases are mild. You have only known pneumonia or mild pneumonia symptoms. But in 14 cases, 40% of cases, it's very severe dyspnea or severe pneumonia. Finally, in 5% of cases, it's very critical with respiratory failure, septic shock, multiple organ dysfunction or failures. How deadly is it? Only 3.5% are fatal, meaning that if you have a population of 100 people, only 3.4, only 4 people would die. But now I think it's almost 5%. Okay. How deadly it is? Here is the case fatality rate, 15%. Oh, sorry, I forget to say that. Sorry, I have to go back. Okay, so 15% of the deaths are more than 70%. 0.2% are less than 40%. That means almost all the people are from 40 to 70. So the most affected, the most people at risk are older people. As I said, more than, almost all the people are more than 60 in some countries. Or it's people with chronic medical condition, heart disease, diabetes, cancer, and so on. How to prevent? You have seen in the newspapers or when watching television, that you have to wash your hands, avoid contact with sick person, or wear mask. What should you do if you develop symptoms? You have to cover when you cough, cover your mouth, your nose when you cough. You have to stay at home and call the medical services for assistance. You don't have to go to hospital. It's only you have some special numbers. You call those numbers and they will tell you what to do. You don't have to go to hospital. What is the situation in the world and in Africa, in our different countries? Here is a map of the world. The color show you how many people, how many cases you are by per country. Yesterday, well, the 2nd of April, yesterday we had in Africa 898 cases. In the world, in total, we have 896,319 cases. And especially in Africa, the total of cases is 7,028. For the death, yesterday, 69% dead in Africa, which will give us a total of 284 cases. Here is the evolution in the world. You see that in the first day, we are talking only about China. But today, it's more Europe, and Europe in yellow, and in green, America. You see that for Africa, it's just a dot on the curve. The top 5 countries in the world are US, Italy, Spain, China, and Germany. Okay. So from the top 5, here is the curve for those countries. You see that US is on the top of the top. This map of Africa shows you the evolution in the country, in Africa in general. The first country for us is South Africa, more than 1,000 cases, followed by Egypt, Algeria, and Morocco with more than 500 cases. You have a lot of cases, a lot of countries with 10 to 500 cases. There is the evolution in Africa from the beginning. It seems to be good. We don't have time, but it seems to be good. And we are waiting maybe next week to see the evolution. The top 5 in Africa, as I said, South Africa, Algeria, Egypt, Morocco, then Tunisia. What is the role of Africa CDC? Africa CDC as African Union in this outbreak. We had some internal intervention and external intervention. The most important was on the 22nd of February, where the chairperson organized in Addis Ababa, a meeting with all the ministers of health of Africa. I think there were almost 35 ministers, what was good, to see how together they can work to fight coronavirus. Here is our activities. The budget for this situation, the general budget is 375 million. And how you can see, we have 3 pillars: prevention, transmission, on working on surveillance, IPC is infection prevention and control, and lab for 230 million. Preventing death with 105 million, with technical assistance to the member states. I am in Côte d'Ivoire to assist Cote d'Ivoire. I have some colleagues in other countries like Nigeria, like Cameroon, okay? And we are ready to send in other countries or other regions some technical assistance, but you know that we'll see it later. Some airports are closed, so we cannot send the technician. So the last pillar for 40 million is to prevent social harms. Yeah, the activities, as I said, surveillance on the point of entry, particularly, but now it's no longer only points of entry as there is a local transmission. The second point is clinical care management of severe infection. Infection prevention and control, IPC. Supply chain and skull pie. You remember that last week we sent at least 20,000 lab tests in other African countries. Okay, laboratory diagnosis and risk communication. So what have we done? Here is information about the first training we organized in Senegal and also in South Africa for lab specialists. We started with lab specialists, and a lot of tests was given to the different countries. Then we did training for surveillance at the point of entry. We formed people on EBS, event-based surveillance. Here are the number of people, 23 countries, more than 70 participants, and also the travel company like Kenyan Airline, like Ethiopian, like Air Burkina, and so on, were part in these trainings. We did also training on IPC, infection prevention and control. One in two, in Abuja, in Nigeria, one here in Cote d'Ivoire. So 39 countries were trained, and there were more than 60 participants at each training. There is also this training online. It's about clinical aspects, clinical meeting with around 300 people from 22 countries. Finally, for risk communication, it was in Tunisia. We organized two trainings for about risk communication. We had more than 60 participants from 23 countries. But what are the challenges and what are the next steps we want to reach? The challenges, as I said, is the closure of some airports, closure of some borders. It's not easy to send technicians, experts in the African countries. It's not possible to send goods in some countries. So here, for example, you have in deep green, 32 countries who close totally their border. They say 9 international air traffic closed and some specific measure in the country. What is the estimated loss in the world? 1 to 2 trillion globally, and only for Africa, it will be 30 billion US dollar. So what will we do immediately? When I said we send people in the different country, if we can, we'll send material. We started with the lab, we started with IPC, but we want to send more if possible. Implementing, we want to implement social distancing measures. The first, you know it, between two people, more than 1 meter, for example. So this one is to show you what would happen without this, without social distancing. Without those measures, we have this, and look at how the risk is small when you don't apply the measure. We produce this guidance. This guidance will tell you about the social distancing during this outbreak, and the other measures, so washing your hands, wear your mask, and so on. For individuals, stay at home if you don't need to be out. Avoid mass gathering, avoid close contact with persons, especially high-risk group. For the community, what happened? We advise countries to close schools and university. We advise to isolate people at risk, elderlies, for example, no mass gathering, no culture or sportive event in our countries. So the challenge are at two levels: economic. We know that everything is closed, everything is going down for our economies, but it's better to respect the social distancing. It's better than to have a lot of money in your pocket. And socially, they have a lot of issues that we are trying. So this last diap show you what we advise and what we will do. Recruiting on board more than 500 people, the central stockpile for the goods, trainings, what is good as well. And in the country, we had also national trainings. All the trainings for now are done by Blue Jean or Zoom, like what we are doing, and so on. Thank you very much, Ruth.
Thank you so much for your quite comprehensive presentation. And I believe there are some of us who have questions to ask. I wouldn't want to go first, but I would want all of us to, anyone who has a question, that you can raise questions, and then we can allow Dr. Gerard to answer them collectively instead of, a single questions. So in case I'm giving this opportunity for any of us who have a question, and we're going to note them down, and then Doctor will respond to them. So Diallo, I hope that's the right pronunciation of your name. Yeah, you can go ahead.
Hello, can you hear me?
Yes, yes, yes.
Yeah, good morning to each and everyone. I'm Chairman of Guinea. My question is that if masks are not available in the locality where we are, what should we do?
Thank you so much for your question. So I'm noting down, and then we can answer these. And I know Dr. Gerard is noting down as well.
And then I have another one, please. Thank you.
Oh, okay. Go ahead.
The second one is about the vaccine, the vaccinations that we are hearing is coming to Africa soon. I don't know what measures will be taken towards that.
Yeah. What about the vaccines? Thank you so much. Who else has a question? Yes, Mary.
From my end, I'm concerned. I'm just asking because. Hello, can you hear me?
Sure, sure, sure.
So I was asking about the masks as well, because right now in Kenya, mostly we are making out masks from fabric because of lack of masks that we can, like the clinical masks. So how effective are they? And in terms of, because we have a relay in, like, there's no supply of masks currently, like it's like we're out of stock. And then yeah, like are they as effective as the ones that are used in the clinics, or are they just something that people are using for the sake of? Yeah.
Okay. Another question about the masks.
I have a question.
Who's this, please? Yes.
Yes, Ruth, I have a question.
Go ahead.
Yeah, I'm Nicholas from Uganda. Thank you very much for the presentation from Africa CDC. Actually, I've attended one of their eco sessions about COVID-19, and it was really hopeful. My question goes to the other priority diseases. I understand that as much as I think we've had a blessing that the numbers for COVID-19 are still low in Africa, but we understand that governments have put up several measures like lockdowns to out the spread of the virus across the continent. And this has affected provision of other health services like HIV, malaria, TB, and so on. Actually, me myself, I've gotten several calls in my organizations of patients being stranded with other diseases at home without any care. Is there any strategy that Africa CDC is implementing to help and address these issues? Because we don't want people to survive COVID-19 and HIV takes them by storm, or malaria or pneumonia. Thank you very much.
Thank you so much, Nicholas. Your question is well noted. Any other person? So I would love to give Dr. Gerard the opportunity to be able to respond to those. But before he responds, I was almost forgetting my own question. And my question is I loved the implementing the social distance. And my biggest question is, what about areas that are not able to implement social distance, like informal settlements? And my other question is on closure of institutions. I agree that you advised schools, education institutions to close. And in my area of work, where I'll mention later, is that we have seen this being implemented. And this has seen institutions like orphanages closed and children asked to go back to unprepared families. What this has done is that it has resulted to many children on the streets. And this means that it's not even easy to mitigate the COVID-19. So I would love you to proceed in responding this, and then we can go to the next session. Thank you very much and welcome.
Okay, thank you. For the mask, it's not only in Africa. If you can see on the television, you see that there is a kind of war. American people, they bought 3 times more than French. So they had some masks from China. It was maybe 100. They bought the pack at 300. I saw French people stealing mask pack from Sweden. So it's a problem. We don't know how to solve it. All our countries, we have the same problem. Yes, I think it's better to have, I've seen some rapper, they did some in rapper and they put it on their nose. I think it's better to have something on your nose which will protect you than nothing when you are in community. I saw people wearing it at home. They say you can wear it at home is if you think you have symptoms, but outside you can wear it. And what you can do is to have any kind. The most important is try to filter the air you are breathing. Please do so. You will not have, it's what we say in French, system D, okay? We have no choice. We have to protect our nose how we can. For the vaccination, I think there is no vaccination. A rumor says that they are trying a new vaccine in Africa, or they will try that new vaccine in Africa. That's not true at all. That's not true. It's only rumor. And we are working on this kind of rumor. If you see someone trying a vaccination in your country, call the police, because then it's not true, okay? Another question, it's about other disease. Yes, we don't forget other disease. We work on measles in DR Congo, and there are a lot of countries where we continue to work. But today, everything on our side and from a lot of countries, it's about this COVID-19. We don't forget the other disease. We continue to work, but you are specific fund from some organization. When they give you money, they tell you what to do with that money. So if you receive money from Bill Gates, and Bill Gates said it's for COVID-19, you cannot use that money for measles or for any other disease. We don't forget the other disease, but now it's COVID-19. Okay. About the closure of schools, I don't know why they closed the orphan school.
I would love to explain literally. It's not that
Yes,
they
please.
closed. It's not that they closed the orphanages, but I can speak in the aspect of my own country, where the
Yes.
ministry responsible, which is the Ministry of Labor and Social Protection, issued a directive that children who have families should be released to go back to their families, so that because in the spirit of social distancing. And what this has done is, as much as there's another point that states children with places who have no places to go then can remain in the orphanages. What this has seen is, I do know a number of institutions that have ultimately closed because they've taken this as a government directive. And so we have children on the streets who have parents who could take care of them, but they cannot go home because, of course, their families are unprepared. So I have seen this, and I know a couple of orphanages that have had to close because of this.
Okay. But I know some boarding school in France, they didn't close the boarding school. Children are in the school. It's their family, because their parents, for example, work in Ethiopia with us. The children are in France. They are in the boarding school.
Okay.
Even if all the school around are closed. So I don't know if I can say it's a national decision. It's not, for me, it's not normal, because when you say orphan, you say someone who has no house. His house is where he lives. But I don't know how to answer to that question. Sorry. And I think you asked to have clarity about chloroquine. Okay, chloroquine, there is Professor Raoul in France who tests chloroquine in a small group of people, and it noticed that it was very efficient. Okay, later they try it on more than around 800 people, and only one person dead. That means it is. But you know, in science, you cannot use a product as medicine if you don't prove. You have to make the proof that it's efficient. So today, all the people, all of us, know that it's efficient. I remember last week, there is a group of 160 persons who tried it. It was very good. But we have to follow the procedure before recognizing that it is efficient. Individually, people are using it and they recognize it is. So now WHO, who at the beginning didn't accept, now they're trying it in 3 countries in Europe, and we are waiting maybe for next week or the end of the month, the result of what they are doing. In the meantime, some president like Trump said it's efficient. I want my population to use it.
Wow. Okay, thank you so much. I would love for, just like you heard from me, I would love for our ambassadors to be able to share their own challenges. Like I did share my own challenge in my area of work, and I would love for us to either share, depending on the goals we are trying to achieve, what is that one challenge, or what are those challenges that you're facing, and what are the lessons that you think they're either good practices, you know, that you would love to share with us here today. So I don't know who to go first, but yes, Mary.
I would like to go first.
Oh, okay. Sorry. Hi, Arnold.
Hello, everybody. My name is Arnold Mugaga from Uganda. I hope you can hear me.
Yes.
My personal challenge sort of showed up with the closure or suspension of work, because our work was primarily to improve classrooms that do not have furniture, to improve learning environments, but school closed. And so it's sort of I came to a place sort of questioning, am I dealing with the basics here? Uh, because somehow school closed, and then a different panic took onto the streets, a panic for the bare necessities for the larger population. We don't know how long this is going on. I appreciate all the efforts that are being made towards preventing further spread and from the medical front, but I started to really worry about this state of limbo and uncertainty from the economic end. I mean, from our sort of day-to-day, if you're a few of us can manage to maintain our our standard of living indoors. However, there are large categories of our population that are severely struggling to meet the basics. Their children are sent home, so there are more mouths to feed. If you don't pay the electricity bill at the end of the month or whenever it runs out, that power will be cut, and so will the water. But lockdown will probably happen 40 days and then another 40 days. We do not know. So I felt that we are it's a bit hopeless to sit in our different corners at home without sort of interfacing to do anything. So me and my partner put out a poll, a problem poll, trying to fish out what other challenges are people facing generally. The response was overwhelming, from food to health, to a sense of security, up to loneliness. There's a lot of people that feel, this social. I go inside. There's a baby that's not happy. So the at the end of this poll, we decided, okay, we try to collect a group of some awesome people, including some One Young World ambassadors, and figure out what do we do. We dubbed a challenge called Smarter Than Corona, because we found that in Latin America, besides the medical front, we should be investigating what next. How else do we think about access for the basics, for the critical parts of our society? And so I'm simply sharing. I wanted to share first to put the link out. If you check oursafrica.com, that's oursafrica.com, and just run through it. We would be excited to get some insight and perspective on what we could do better and how we could go about creating a mass. We're trying to create a mass design sprint, a design thinking challenge. So we've built tools, online tools, to take the population, to take sign-ups from the population through a 3-day. Can you hear me?
Sure. Carry on.
Okay. To take the mass population through a 3-day guided process to ideate around solving these new problems. And so there are problems that they have identified themselves. We categorize participants into teams, and then they get a mentor, many of which are coming from our One Young World community in Uganda, and they will sort of go through a guided step-by-step, understand the problems, start to think through different solutions, pick out their best solutions, and we work towards rolling these out and creating relief where it is not created. Because I feel that we must step up to support the medical front, for example, as a collective community. And this is simply a point to share. Thank you for listening, everybody. And thanks for having us. We appreciate it.
Thank you so much, Arnold. I feel like you have tackled even best practices, and we appreciate what you're doing. I hope people are taking notes. And I know that Sheikh Omar would want to equally say something. So please share with us what you're doing, the challenge, and I would love to request that we observe time as well so that we are able to have everyone figured out in this conversation. Go ahead, Sheikh.
All right. Greetings, everyone. I hope you're all doing great and staying safe. Here in Mali and in some other African countries, the organization I work with called Youth for Change Africa, we've noticed that something that's really tricky is we are doing most of the actions that we are taking online. And we do understand that uh, the virus is out there and the risk of contamination exists, but how many people, especially here in Mali, that was the first question I was asked by a team member, is how many people have access to what you're putting online, and really, and the language barriers also. For example, here in Mali, we have 30 other national languages, and the official language is French. So many, information that are being shared about the disease is being shared in French, and we are leaving out, majority of the population that are those who are not online and those who didn't go to school, those who living in rural areas. So from that point, we just decided to go out, and to train. We've been training young people, in a way that they can go out, share the information, train other people, have the discussion about the disease, inform people, without getting, without putting themselves at risk, respecting the 1 meter barrier, using a combination, regardless of the means we have. That's direct contact has been really, working for us better than online work. And many times when we speak to people, whether it's in markets, whether it's in overpopulated areas, people are saying that TV and internet are just taking them to freaking out. They are freaking out because of TV and the internet. And having the discussion with prepared people is a lot more helpful. So that's something I wanted to share with everybody, that it's quite I, I I mean safer to be online, but we'll reach more people by being on the field. And something also we're doing about masks, about keeping hands clean. We are making ourselves using 20-liter containers to create what we call hand washing stations around the streets. We just make them and then we put them in the street, so people by walking around could wash their hands and things of that nature. By mask, I heard the question, and what I would say, if you know anybody who's familiar with 3D printing, they could print reusable mask, and that's something we're really doing here in Mali. It's 3D print reusable masks that people could use and reuse, and that works too. About masks also, yes, there are online. We've seen, I think it's a hospital in France that showed how you could make your own FFP2 or FFP3 type mask, and we're using that method. By the material is fabrics we have here, but we use their method, and it's been quite safe for a lot of people. Concerning the kids out of schools, also we thought of doing something pretty great. What we did is build an application, and it's an application that you can use without being online, without internet or any kind of data, that actually explains the disease in local languages, but also allow kids to play games that teach them really how to stay safe during this period. So those are what we are doing. And the major challenge really is that, to me today, is the majority of Africa's population is that do not have access to the information. That's the report I'm getting for several other countries, is that those who haven't been to school, those who don't speak French, English, or official languages, those who are not using WhatsApp or Facebook, are not getting the proper information, are not getting enough information, and that could be, a huge turn. So that's what I had to say, and I would like to thank everyone.
Thank you so much, Sheikh. But before I even give someone else a chance, I would love Dr. Gerard to just respond to the reusable mask. Is it healthy? I was just, I can't stop thinking about that as you were speaking. But I feel you're doing amazing and would love, of course, to learn more about the app, and which I equally think it's brilliant work. But before we go to the next, I would just want Dr. Gerard to respond on how effective and healthy are reusable masks.
Okay, thank you very much. I notice, I'm in Cote d'Ivoire, as I said, I noticed the same situation here. People are washing the mask and wear it again. I cannot say it's safe to do so, but it may be important to protect inside your washable mask. If you can protect inside with a tissue or something, you can isolate more your nose and the exterior. This will be
Doctor, I
yes.
won't cut you off. The 3D mask we are making do not look like anything as the conventional masks. It's really made of, it's made of plastic actually, and it had
Plastic.
yes, it has a breathing spots, and it's made in a way you can wash and rewash it. So there is this little filter spots, and you could switch the filter. You can disinfect the mask, and then you could switch the filter. And to switch it, all you need is normal tissue, and you could use that to do it. So actually, we've tried it, and we have doctors here look into it, and it's been quite healthy. It's not like we are buying mask and washing it or reusing it. No, these masks are being specifically made to be able to be reused.
Okay, Umar, I'm happy to know that. Maybe if you can send me a picture, I would be very happy to see it. If not, you're in Cote d'Ivoire, some people use fabric. They use fabric, okay? They use wrapper to do some mask. They wash it and use it again. So maybe they are exposing themselves to other type of disease. I don't know if you understand what I mean. But if you say this one is safe, it's okay.
Yeah, okay. Thank you so much. I feel Jake sounds very confident with the product, but I believe we can follow up a conversation with him and to learn more, and just equally to see what other ambassadors think about it. But of course we would need a perspective from CDC, a person like you. And so I want to give Mary the next chance. Mary, share with us the challenges and best practices from your end.
Hi, everyone.
Hi.
Mary from Kenya, specifically based in the informal settlement of Kibera, which is, I hope you all know, it's the largest slum in East Africa. So as COVID-19 has hit us, as a young person from the community of Kibera, I normally engage myself on normal days with young health program where we do sensitization of non-communicable diseases. But at this moment, we are again not in a position, or we are not able to generally just continue with that program on a physical approach. So what we've done with the program is just take it on an online platform. And on the other side of it is these peer educators, we all agreed we cannot just sit on the sidelines and watch as things happen. Being that our community is very populated, it's one of, we feel like if anything was to happen, it would be the most hit hard. So right now, as a peer educator in Kenya, mostly in Kibera settlement, we've gone out of our way to do sensitization. Personally, I've gotten training on COVID-19.
Please, we can hardly hear you over here. Talk louder, please. Thank you.
I hope you can hear me now.
Yes.
Oh, okay. So as I was saying, so personally, I've been trained, and we're a team of 40 volunteer, 40 PhD.
Mary, I think your internet has an issue.
Oh,
Yeah,
I can hear you very clearly.
Carry on now, carry on.
You can hear me now?
Yes.
So as I was saying, I've been trained with some other peer educators we normally work with. We're a team of 40, but at least 20 of us have been trained on how to sensitize the community. So when it all started, mostly for Kenya, we were doing door-to-door campaigns, but of course trying to observe the 1 meter distance. And I can for sure say it's not easy because our community is very populated, and it's one of those things that 1 meter distance really is a hard thing to deal with. So people in the community have come up with very innovative ways of making up masks from fabrics or Ankara prints that have been, used from just making masks from fabrics that they have around, which is very easy. And we've gone out of our way to, mobilize these young designers across Kibera who can actually go out of their way and make masks and distribute them for free. The other thing we've gone out of our way to do is just to set up stationary points where people can actually wash their hands, because we don't have water coming into our houses. People have to go to central places to fetch waters. And it's one of those, when we say like people need to wash their hands, it's not like most of them do not have really that much water to go around washing their hands all the time. So we've hiked up like in the entry points and the exit point of the community, we've kind of like hiked up so many water points where people can actually wash their hands. And as they're doing that, we're also sensitizing them on how to even wash their hands, because it's one thing to just wash your hands and the other bit of just actually washing them properly. But in the midst of doing all that, during our door-to-door campaigns and also just sensitizing the community, people are already like in a panic mode by the fact that our government brought up the curfew thing where your time to be in your house should be at 7 p.m. People in this community are not able to match up to that because most of them are casual laborers, and they literally go to industrial places to work for a daily meal. Most of them live below $1, and it's kind of hard because companies have shut down. People have laid off some other people. Most nannies have been laid off, and most women go out of their way to go to like the uptown area to wash people's clothes. It's no longer possible to do that. So we have a majority of people with their kids home, being that schools were shut down, with no basics in terms of a meal a day, and they're trying to make ends meet, and then they have a curfew to beat. So that's like the few challenges we've found on the way, and we're just picking up the pieces as we're moving on. So the initiative of the young people over the last 2 weeks is just to like sensitize the community, make sure that people have correct information, and of course try to help people to kind of move from the panic mode, and also not to be, of course, people are scared, and because of that, being scared, they're going out of their way to endanger themselves. So we are trying to just make sure that people understand that we can actually beat this by working together. So as young people, what initiative we've done, because we just want to make sure that everyone has a meal per day, is gone out of our way and into our pockets. Like personally, for the last 1 week, I've supported 3 families. And I feel like when people are able to pull more resources together, we are able to do more as compared to just one person doing it. So we've started initiatives, which I, of course, shared in our group, and so many other groups where it's been taken very positively. And we are also trying to also partner with other people who are doing the same thing so that we can also do it massively. So yeah, like from our end, mostly from my end, that is what I'm trying to push forward, and just to make sure that people have information, they have the correct information, and that they can rely on us as role models in the community to be able to give them correct information and just support them through this time. I think that's
so much. Thank you so much, Mary. I can echo your sentiments. I'm from Kenya, and I totally understand where you're coming from. And Yeah, just taking coming from a solutions point of view, I think you're doing amazing, and all of us can learn from that. And I hope whenever possible we are able to work together and support each other in different um, interventions. So I would love for, what I'm getting from all of us here is that someone is doing something and there are still gaps. And what I would want to do for the next 10 minutes is that we can brainstorm on three major questions. And one is, how can we strengthen innovative communication tools between institutions and the local community, you know, both online and offline? Because like Mary just, you know, she told us about what is happening on ground. But so what can we literally do? And this is for all of us to brainstorm, and we're going to get to respond to these on what we think, and these will be able to help us going forward. My question number two, maybe we can all note down, and then we can just brainstorm for the next 10 minutes or so. Then how can we mobilize and organize the youth and the non-governmental actors to play a key role in prevention, response, and transformation of the crisis? Of course, we are all young people and we are equally doing stuff, but how do you think we could mobilize and organize the youth? I know Brian Chesoli, I hope he's in this meeting. He had, you know, spoken about something of the sort. But how can we collectively do this? Then our last question would be, what are the best practices and learnings we can share from countries and other, you know, and other viruses like Ebola, HIV, etc. I know some have been shared already. In case there would be an addition to that, then we could talk about it now. So we only have 10 minutes. If you already have answers to these, I can give you an opportunity, but let's all of us
Yeah, look,
brainstorm.
I want to say something about them. This is Dr. Nicholas once again from Uganda. Actually, as you pose those questions, I get excited. And as I was hearing people presenting about the different things that are being done, it also becomes exciting to know that at least everybody is doing something.
Excuse me, Nicholas, a little bit. I think there's so much noise from the background. If you could resolve that, then we'll be able to hear you properly.
Okay, I think the noise has been resolved. I was saying that can we have a common platform where we can see what everyone is doing and how we can feed into what each one is doing? Because when I had people presenting, there were so many lessons to learn from what they were doing, which could maybe be implemented in Uganda or elsewhere. Could we have a common platform, like a social media platform or any other platform where every youth who is doing something can come in and share their experiences, and maybe it could be replicated elsewhere? Thank you. That was my main point as we go into the discussion.
Thank you so much, Nicholas. Your point is well noted. Yes, who would be the next person? I love your idea and it's brilliant. A common platform where everyone feeds into what they are doing. Yes. Who want to go next?
Hello.
Hello.
Yes. So my name is Albert. I'm calling from Nigeria. Just summarily, I would say from the perspective of mobilizing the young people, I think most of what the youth these days are into is more on advocacy and information access and helping to control the situation on ground, which is all well and good. But there's a component of a response to such a pandemic that some of us are not noticing as much. And as a biochemist and an innovator, I think I am more inclined to such an aspect because of my own personal inclinations. And so instead of the reactional perspectives we all have to it, we need to take a proactive STEM-based approach to it in Africa. Now, I have been working with my team to come up with possible vaccine/cures, but because of the shortages of virus patients and so difficulty in getting viral strains here in the state I'm currently in Nigeria, which has no recorded cases, so I am unable to access some certain strains. We had to resort to bioinformatics approach to drug discovery. And for us, we've had issues with possible funding for the next phase of the work. And then we have had to rely on venture capital And so organizations like the SOSV, like Revel Bio, Indie Bio, and in Nigeria here, Co-Creation Hub and some of the others are all pulling out financial resources to pump into science and tech or biotech research towards a cure or a vaccine. I realize most of us in Africa are not thinking towards that. We're mostly working towards mobile apps to monitor, to track, for information, for which are all well and good. But it's almost as if we're just biding our time till when the problem gets solved. But if we don't solve it, then when would it get solved? So I think for me, mobilization I've been trying to do is, as well as the lab work I'm doing, is also try to connect young people and young innovators to possible sources of funding to channel into their research now towards a more proactive solution to the COVID-19 pandemic. So I think from my perspective, that's an aspect of mobilization we haven't really talked about as much that I think is worth mentioning.
Thank you so much, Albert. And we agree. Yeah. Thank you for willing to be able to do this. And just to respond to Nicholas, I wanted to, Mary just reminded me about the One Young World community, because we have a resource where we are sharing all the different things that people are doing in response to COVID-19. We are going to share with you if that is not still available on your end, but equally, we know there are other and different people doing different initiatives in the community. So we're going to share and make it open for all of us. And yes, that could be a starting point as well. Who else want to go next? Who has something in regard to the three questions?
Okay, yes. So I am Isaac Olufadiwa. I'm the Executive Director of Slum and Rural Health Initiative. I'm also the One Young World Coordinating Ambassador for West Africa region. And definitely, as regards to communication strategies, it has been highlighted earlier in today's meeting how most of our communication materials has been, either in English or, in French or in most of the really important languages, or let's say widely spoken languages. But to really reach and really communicate with grassroots, people in the grassroots who probably do not even have an understanding of these languages, it's very important that we are able to get to them using their local languages. And my organization was able to really work with a lot of One Young World ambassadors, and we're able to get this information, translated from WHO infographics, into like over 55 local languages in Africa, and such as things like stay at home, do not touch your face with your hands, regular hands washing for at least 20 seconds, avoid large crowds, in a very, very simple form. And we have it in so many African languages. I think I'll be dropping the link on the chat section where anybody can just really access it. You could check. I think it's also available in local languages from, I think we had somebody from Togo too that was saying something about this. And I think it's really important that we have more local languages in Africa, and we need to add more to these infographics. So either for people that really want to really get engaged, we have that could help translate these messages into more local languages. I think it's really a welcome idea. We'd also share it on One Young World platform so that more ambassadors or more youth can really get involved in this movement, where we have to really collaborate to ensure that local people are met with the right health information for them to really be able to handle the information. I think one of the things that really make people panic or make people scared about the situation is they don't really have the access to the right preventive information. I think really by doing this, by communicating with them, like some other people have really also identified in today's meeting, such as Check and so many other contributors, by communicating with them in the right language which they understand, I think it's really going to go a long way. And then we can really involve young people and youth-led groups in this by ensuring that we communicate with people in the local languages. Thank you.
So thank you so much, Isaac, and I agree with you that especially when it comes to sharing of information. In my own country, we've had a narrative that black tea actually cures coronavirus, and this has been very unfortunate. And so this actually hinders people from getting the right information and hence not taking the right measures. So I agree with you, and your point is well taken. Stephen from Storylink, I would want you to respond on the best practices and learnings we can share from countries and other viruses, because I do know you're doing something in non-communicable diseases, and I see you have a suggestion. So if you could just take at least 2 minutes and just tell us of some of the learnings that you think we can pick.
Hello, can you hear me?
Yes, yes.
This is Chairman of Guinea.
Okay.
I wanted briefly to say something about the best practices.
All right. Okay, go ahead, and then Stephen will speak after you.
Yes, yes. What I would say is that don't panic around your community, within the family, to let everybody know that it's real, but don't get panic. You just have to respect the preventive measures and follow them very closely. But don't lead no one to panic.
Thank you so much. Thanks for giving people hope and being very positive about this whole thing. Yes, people are really panicking. And yeah, we appreciate having this. Is Stephen ready, or he's left the meeting? So in case he's not, I would be happy to.
Can I add something?
Oh, sure, check.
Okay. Something you just said, when people say that black tea heals coronavirus, you know, we have to be really as young African leaders, you know, we have to look at certain aspects also of our communities. Uh, Today, the whole world is looking into, you know, like looking for a treatment, and we've seen today. I've seen the French communication agency saying that everywhere else on the globe, people are looking for treatment, and Africa has been really silent. But I'm aware of the fact that in Benin, in Senegal, in Burkina Faso, clinical tests are being made, you know, on certain other products that could be curative for the virus. So at a certain level, that also will be important. It will be important for us as young leaders to get the proper information on what's happening scientifically on the continent. What are the African scientists doing, and how we can help them promote what they're doing? How can we help them, you know, test or you know, or do a better job? Because that also is quite important. We can help community wise, we can help the institutions do their job, but we also have to think about our scientists and our doctors. How can we help them do a better job? And something I was really thinking about today after reading the news article saying that Africa is not doing much is that uh, today, you know, science is showing, well, modern science as we know it is showing a lot of its limits. So maybe it's time that a continent, you know, rich in natural resources, not only underground natural resources, but on ground, I mean, vegetations and things of that nature, we can look into that and really use it to do the best we could for humanity. That's something I just want to attract your attention on.
Oh, thank you so much. Thank you so much, and I absolutely agree. Do we have any other person, or I can move on to the next? Who wants to? Matthew Lam Joar.
Hi.
Hi, welcome. And do you have something to speak to us?
Hi, everyone. My apologies for coming in late. Happy to see everyone, and I like the topic that we're talking about. I think I missed much of speeches, but what I would say are whatever we are going to come up with, the responses that we'll come up with to help our communities cope up with this. I come from Kenya, and I'm working with refugees a lot, doing a lot of sports with them. And I came up with something like an initiative to help them also, that I can do the little bit that I do to help them. So we bought soap, my organization, and we bought soaps and some detergents, and we are distributing them to the few that we can reach out to. So this is an initiative that we are doing in the refugee camps of Kakuma, and passing a lot of awareness. And me being a sport person, I also developed a flyer that can help them or help my team to practice some fitness, you know, because in the house, you think like you are at home, you have no access to gym, but there are some those things that you can do that can keep you fit. So I developed some flyers that I put in some instruction on how they can do some sport at home. So this is what I'm doing in my side, and I'm wishing and hoping that the world come up with a solution of this pandemic that is making everybody fear and not trusting anyone. So yeah, thank you.
Thank you so much, Lam. And just to add something onto your point is that even as we are going to grapple with this and what is happening globally, that we need to remind ourselves that the most marginalized pay the highest price. And these could be children on the move, this could be the refugees, this could be, you know, that we remember that there are gaps that we need to feed. And so I just want to thank all of us for making time for this meeting. And I would love to welcome Dr. Gerard once more for him to give the final remarks. And then I'll invite Aya to equally share with us on have views on this. And we will get to close. But so for now, I'm welcoming Dr. Gerard to just tell us generally what he feels about this. So welcome.
Thank you very much, Ruth. I think the most important part of your meeting is the contribution of youth in this fight. And the most important thing is communication. You are ambassador. You can easily communicate with the population. You are part of the city, so you are able to communicate with your own community. So please take your part in that fight. The fight is not only for epidemiologists, it's not only for medical services, it's for you, for everybody. Thank you very much for inviting me. And I was very pleased to be part of this meeting.
Thank you so much, Dr. Gerard, and it was utmost pleasure to be able to hear from you today and for sharing the insights with CDC. And so before I call Aya, I'm gonna just say my last words because I'll ask Aya to close the meeting, but I just want to thank each of us because every time I listen to all of us, it just gives hope that there are solutions to the problems and the solutions lie with us. I would say that we need to share all of this on what we are doing, and we are able to tap into different available resources. And so it's my utmost pleasure to be part of the One Young World community and of course the youth, and just so that we were able to have this conversation. And I hope that everyone will keep safe. Madam Aya, so could you just talk to us as we call it quits?
Thank you. Thank you so much, Ruth, for the excellent moderation. Thank you all for participating and sharing your experiences and your initiatives and the best practices. I think especially the call to action from many of you just says a lot about why this platform is important, the One Young World ambassadors. It's important to keep the pace and raise the voice. And I invite you to also look at the virtual AU Youth Consultation COVID-19 page, and you can host actually your own consultations because each one of you is leading whether a youth organization or part of a youth community. So you could also host it in your own language. There is the guidelines for it, the format, the outcome, and we're happy to support from my office in collaboration with Africa CDC to provide presentations or to have team from Africa CDC join some of these consultations. I want to also thank Dr. Guy for your time and for engaging throughout the session with the youth. This is the second session I do with Dr. Guy, and Africa CDC is leading the continental response on the pandemic. So I'm sure Dr. Guy will feed back into the work of Africa CDC, your concerns, your challenges, and the ideas that you shared. Please also do share credible source of information from Africa CDC website and social media. There is a lot of communication content that have been produced. You can always tag AU Youth Envoy on social media to bring our attention to the challenges or initiatives that you want us to amplify, and we continue to do so with many youth initiatives. I think this is the time as African youth to unite and to come together and to build a movement to fight COVID-19. We need to self-organize, we need to support each other, we need to mobilize our peers, to activate our networks, to influence the circles that we have, whether at the community level, at the national level, at the organizations level. We need to inform the public. We are all affected by this crisis, so we really must all contribute to the solutions because we are responsible leaders. I think this is really the time for youth power and youth leadership, and I'm hoping the One Young Word ambassadors, African ambassadors community will step up to the challenge and really lead this engagement. So I just want to end by wishing that all of you stay safe and sending you a lot of solidarity, and just assuring you that at the African Union we are committed to support your action on the ground and on the front line of ending this pandemic. Thank you very much, and we will also follow up with sending the report. Thank you, Ruth, again. Bye-bye, everyone.
Thank you so much.